Now that we've covered the criteria, let's put it to the test and look at a practice vignette. So just bear with me. This is a bit of reading, but hey, if you're studying for the National Clinical Mental Health Counselor exam, you should be prepared for this. So let's say that we have Amelia. She's a 45-year-old manager and she reports feeling anxious almost constantly for the past 9 months. Her anxiety focuses excessively on her work performance, whether she remembered to pay all household bills on time, and the minor illnesses of her children. She reports that she simply cannot turn off these worries, even when trying to relax, and the worrisome thoughts interfere with her attention to tasks at hand. She has been experiencing chronic fatigue, persistent muscle aches, and wakes up frequently during the night feeling tense. She reports that her constant worry has made her feel on edge with her colleagues and has recently led to decreased productivity at work. Her primary care physician recently checked her thyroid levels and found no abnormalities. So the question is a generalized anxiety diagnosis appropriate? Do you think Amelia meets the criteria for generalized anxiety disorder? And I'll give you a few seconds to think about this. So the answer is yes. Based on this vignette, a generalized anxiety disorder is appropriate for Amelia. And let's break down why that is. So first of all, let's go line by line, criteria by criteria, since it's important that the potential client or patient that we're working with meets all of the criteria for generalized anxiety disorder, not just some, not just most, but all. So criteria A, excessive worry for 6 months or more about multiple events. So Amelia has been anxious almost constantly for 9 months, worrying excessively about work, finances, her bills, and family health, so her children's illnesses. So we can confidently say that that criteria has been met. What about criterion B? Difficulty controlling worry. So Amelia reports she simply cannot turn off these worries, and the worrisome thoughts interfere with her attention. So this has been met. What about criterion C, which is 3 or more of the associated symptoms? There were 6 total. So Amelia reports chronic fatigue, that is to say, she's easily fatigued. She experiences persistent muscle aches and wakes frequently, so sleep disturbance. She also reports feeling on edge, which is just another way of saying she feels restless or keyed up or on edge. Um, so with criterion C, we can say that she met the criterion because we only need 3 symptoms to be met, but she's met more than that, 4. So we need 3 or more. Now let's look at criterion C, clinically significant distress or impairment. So her worry has led to decreased productivity at work, confirming occupational impairment. So she's experienced real clinically significant impairment in this domain. Now, criterion E, not related or not due to substances or medical conditions. Her physician ruled out medical conditions like thyroid issues, so therefore we can assume that she's had a proper medical workup and she does not have medical conditions or substance use that is contributing to her presenting symptoms. Next, when it comes to criterion F, not better explained by another disorder, her worrying is generalized across routine life circumstances, and the domains encompass health, finances, and work. And this distinguishes it from highly specific anxiety disorders like obsessive compulsive disorder or panic disorder. So we can confidently say criterion F is met. So again, something that separates generalized anxiety disorder from other disorders is that it generalizes across many domains. It's not specific, it's not narrow, it's generalized. All right, so now that we've looked at this vignette, let's look further into some of the associated features of generalized anxiety disorder. So what are perhaps some of the characteristics or correlates with generalized anxiety disorder? See you in the next video.